It's time for a wellness revolution. Brought to you by Hotze Health and Wellness Center. Honest discussion on maintaining health and wellness naturally to enjoy a better quality of life.
He's the doctor fighting to let you keep your doctor.
Now, Dr. Stephen Hotze. Dr. Hotze's Wellness Revolution podcast is brought to you by Physicians Preference Pharmacy, formerly Hotze Pharmacy.
Welcome to Dr. Hotze's Wellness Revolution. I'm Stacey Banfield here with Dr. Stephen Hotze, founder of the Hotze Health and Wellness Center. And we always encourage you to download our podcasts at hotzepodcast.com, Hotze podcast.com. Well, we have got a good topic today. In fact, it's a great topic. It is on what I call the feel-good hormone because I don't know how I could live without it. So without further ado, Dr. Hotze, maybe you could explain what that hormone is and why it benefits so many women.
The hormone is progesterone, and this is a hormone made in women during their menstrual cycle. Now, let me explain. When a woman hits puberty, her ovaries begin to make two primary classes of hormones. It makes progesterone and it makes estrogen hormones. The estrogen hormones are three different types of estrogen: estriol, estradiol, and estrone. So when a woman starts puberty and starts beginning having her menstrual cycles, the first day of her period, she'll begin to start to secrete in her ovaries estrogen hormones, which are proliferative hormones, which proliferate the inner lining of the womb. Although they affect every cell in the body, they cause water retention, they can cause breast swelling and tenderness. And so it proliferates the inner lining of the womb, and then mid-cycle a woman will ovulate and begin to make at the area where she ovulates in the ovary, the corpus luteum, she'll make progesterone. So the proliferative hormone is the estrogen hormones. They proliferate the inner lining of the womb. They affect every cell in the body. And then when she ovulates, she makes progesterone, which matures the inner lining of the womb in preparation for a pregnancy. If there's no fertilized egg, if there's no pregnancy, then the hormone levels dramatically fall, and that causes a sloughing of the inner lining of the womb or the uterus, and a woman has her menstrual period, and then the whole process starts over again. So in a perfect world, every 28 or so days, a woman is going through her menstrual cycle, making estrogen hormones, and then ovulating and making progesterone, which balances out the estrogen. Well, when a woman starts her periods in puberty, she becomes mature, and her hormones begin to mature, so she becomes fertile, obviously, when she starts having her menstrual cycles. And the height of her fertility is in her teen years, in her early 20 years. That's the height of fertility. All the women can get pregnant all the way into their 40s or even older, but that's less common. We normally recognize that the most common time women get pregnant are in their 20s and maybe into their early 30s. And this all has to do with the rhythm, the cycle of their hormones. Now, as women mature, their hormones begin to fluctuate. This can happen to some women right at puberty. They don't Their hormones don't balance out. They don't make enough progesterone. And this can happen after childbirth. It can happen in midlife at about 35 for a woman, especially as they move into their 40s, as they approach menopause. What happens is the progesterone levels made by the ovaries begin to decline. As a matter of fact, by the time women hit their early 40s, they often have anovulatory cycles. By that I mean they don't ovulate. When they don't ovulate, they don't make any progesterone. And all they have is the effect of the proliferative effect of the estrogen on their womb, so they build up heavy tissue, and their periods become heavier. They get clotting, they get cramping, they get breakthrough bleeding. So that can happen at any different stage in a woman's menstrual life, but historically and statistically, this happens once a woman hits about 35 or 40. She begins to notice her periods go from being from 3 to 5 days, and mild to moderate menstrual bleeding to 5 to 7 days with heavier bleeding and maybe some cramping. And then as she marches through her menstrual life, goes 7 to 9 days. They get heavy bleeding, cramping, fibroids, breast tenderness, mood swings, fluid retention, headaches, migraine headaches, and mood swings. And these are the signs of estrogen dominance and progesterone deficiency. It's a coin. One side of the coin means estrogen dominance. The other side is progesterone deficiency. So when these symptoms begin to happen, oftentimes a woman will go to her OB-GYN or general practitioner, and they'll just put them on birth control pills. They'll put young girls when they're having irregular periods. In their teen years, they throw them on birth
Happens
control
all the
pills.
time.
And that absolutely shuts off the normal production of the natural hormones, and it gives them counterfeit drugs which counterfeit the hormones. So when a woman takes birth control pills, those are not the natural hormones. They suppress the production of the natural hormones, and it can lead to a host of health problems, and it can cause anywhere from depression to mood swings to decline in energy levels, weight gain. A host of health problems can be associated, and an increased risk of breast cancer for women that are on birth control pills over a long period of time. It's not natural. So if a woman is having some problems with her menstrual cycles in the last half of her menstrual cycle, premenstrually, the important thing to do is to give her progesterone, natural, bioidentical, and by bioidentical mean the molecular structure, the same molecule that the body makes. You can simply supplement that to balance out the estrogen with the progesterone. It's kind of like a seesaw. You want to get a good balance in that. And so as a woman matures, you add a little more progesterone as you go along, and this can be a godsend. It can normalize the menstrual periods, prevent fibroids. As a matter of fact, women that have problems conceiving oftentimes have problems with progesterone deficiency and estrogen dominance. When a woman is estrogen dominant, in other words, she's making more estrogen than progesterone, and they're not balancing out, that estrogen dominance adversely affects her ability to utilize thyroid hormones and to convert thyroid hormones to the active thyroid hormones. And so she becomes functionally hypothyroid, which also plays a role in her infertility. So the hormones work together synergistically, and we find that oftentimes when women come in and they have the symptoms of progesterone deficiency or the other side of the coin, estrogen dominance, it's beneficial to add a little bit of natural thyroid as well as add progesterone. And the progesterone can be a godsend. It can cause a woman to eliminate all her premenstrual symptoms, get her periods back into a normal, a more normal 3 to 5 day period rather than a long extended period with breakthrough bleeding, and it can help prevent fibroid tumors. It also, by balancing out the hormones, if a woman's had problem with infertility, it can also help them get pregnant. So I always think the best thing that a woman can do if she's having problem with infertility, don't go to an infertility clinic that's going to do a whole bunch of IVF, in vitro fertilization, do all those sort of things.
Try progesterone first.
Try natural progesterone or natural thyroid. And we have seen numerous women who have come in with the problems with infertility. We simply gave them some thyroid and we gave them some natural progesterone, and they did fine. I'll give you an example. I have my youngest daughter during when she was at the university, was having problems. She was not having any periods, and this went on for about a year or two. My wife told me she hadn't told me. I said, "Well, honey, bring her in and let's take a look at her." And so I had one of our physicians here at the Health and Wellness Center evaluate her and got her up on thyroid and got her on some natural progesterone. She started having periods regular again. Now she's got 3 little boys. So here's my daughter would have been a common woman if she'd gone to a regular conventional doctor or OB-GYN. They just simply put her on birth control pills and forced a period on her, but that wouldn't have given her fertility. That wouldn't have reactivated her ovaries, which were not working well because they weren't getting enough thyroid hormone. So that's an example of the importance of not only the thyroid hormones, but progesterone in ensuring that the hormones are properly balanced. They work together synergistically, and a key hormone in a woman's life to keep her healthy and well moving up to her menopause is progesterone. And after menopause, that's very important because progesterone also enables the bones to create more calcium to keep the bone strong and prevent osteoporosis.
Yeah, and
progesterone is a very important hormone, and it's the feel-good hormone because it helps you.
Right.
It helps you think well. Remember, the hormones affect your neurotransmitters in your brain, and so if you only have estrogen, it's the dominant hormone. It causes fluid retention. You get headaches. It can cause change in the neurochemistry of the brain, and you don't feel
It's
well.
amazing.
You get mood swings. Progesterone balances that out. Helps it
gives you a sense of well-being.
It gives you a sense of well-being. It calms your nerves. Helps you sleep well. It's a godsend.
It absolutely is. And we really encourage all the ladies out there who are suffering from perhaps it's infertility or they've got various PMS symptoms. I mean, what do you have to lose? I mean, it's just one of those things. It's basic. Your body makes it naturally. Why not supplement what your body actually needs? You can give us a call at 281-698-8698 for a complimentary copy of Dr. Hotze's best-selling book, Hormones, Health, and Happiness. He wrote it for you. So just call us at 281-698-8698. Thank you for joining us here today on Dr. Hotze's Wellness Revolution.
A special thanks to Physicians Preference Pharmacy, formerly Hotze Pharmacy, proud sponsor of Dr. Hotze's Wellness Revolution podcast.
Information provided on this radio program is neither intended nor implied to be a substitute for professional medical advice and is not intended to replace the services of a physician, nor does it constitute a doctor-patient relationship. You should not use information from this radio program to diagnose or treat a health problem or disease without consulting with a qualified healthcare provider. If you have or suspect you have an urgent medical problem, promptly contact a professional healthcare provider or call 911. Dr. Hotze's Wellness Revolution radio program advises you to always seek the advice of a physician or other qualified health provider prior to starting any new treatment or with any questions you may have regarding a medical condition. Any application of the recommendations from this radio program is at the listener's discretion.